simply put, most basic terms, postpartum hemorrhage is when you have excessive blood loss following delivery. Now, there's been a lot of discussion in the literature over the years about what the threshold for postpartum hemorrhage is. The World Health Organization defines it as a blood loss of greater than or equal to 500 milliliters of blood within 24 hours of birth. That happens for about 6% of births worldwide. And then they have a more severe category that they call severe or major postpartum hemorrhage, which is more commonly defined as greater than or equal to 1,000 milliliters of estimated blood loss within 24 hours of delivery. Or it could be blood loss accompanied by signs or symptoms of hypophobia within 24 hours of birth. And that's affecting about 1.9% of births worldwide. So, the other part of your question, why is that increasing in the United States, is a question a lot of us are asking, right? And I'm not sure that we've all reached consensus on the right answer. So there are some clinical risk factors that increase the risk of postpartum hemorrhage, like uterine atony, uterine overdistension, cesarean delivery, uterine fibroids, and also advanced maternal age. Those tend to be increasing on a population basis. So as more folks have those risk factors, it makes sense that we see more folks having postpartum hemorrhage. Some other risk factors that have been identified are body mass index greater than 25%, having not a normal hematocrit level at admission for delivery, not having delivered a live baby before, nulliparity, as well as hypertensive disorders. If you can't get the bleeding under control, someone will die. Fatality is one of those outcomes. One of the last resort treatments for postpartum hemorrhage would be a hysterectomy, peripartum hysterectomy. This we did see a small increase in rates in this hysterectomy between 2000 and 2009. It didn't change between 2009 and 2016, and since 2016 to 2019, it's been dropping. But of course, having hysterectomy would, induce menopause. Sheehan syndrome can also be a very rare complication from postpartum hemorrhage, but it is rare. And I also just want to highlight one really interesting associated risk or outcome that I found. A recent meta-analysis found that postpartum hemorrhage is also associated with an increased risk of postpartum depression. So in short, postpartum hemorrhage can be really dangerous if it does happen. But the important thing to remember is if people can identify that a patient is at risk early, identify that they are actively hemorrhaging quickly, and then take appropriate action in a timely way, often those negative outcomes can be avoided. So our work is arguing that we need to find systems and processes and structures that can help support clinicians in anticipating risk, detecting the hemorrhage, and then responding in an appropriate, timely way.